Hi Year 10, Miss Rowe again. Hope you're having a good half term. Just a few days now, so I thought I'd make you a collaborative video to cover learning outcomes 1 and 2. So that's grade P1 and P2, okay? So we'll go through that anyway. I'll start on P1. So for P1, you need to be able to identify one example of a health and social care service from each of the following types of provision that can be found in your local area: statutory, private, voluntary, and then list the functions of each of the services identified. So a bit cheeky that one really, because you might think, brilliant, I've done it, I've talked about statutory, private and voluntary. Then if you look in the book, really small writing, it says underneath, list the functions of each of the services identified. So if we go about talk about the different types of services, so the functions, as you can see on this page, is meeting long-term and short-term needs, residential care provision, community care provision, respite provision, rehabilitation, and specific service provision to meet needs. Like, what does that all mean? So for the types of private, the function side is functions of health and social care services. So meeting long-term and short-term needs, you need to be able to meet a wide range of different care needs. So they might have a serious illness that might mean someone has to have long-term care that requires medical and social care for the rest of their life. For example, an individual with chronic lung disease or heart disease, they may have ongoing medical and social care needs for life. So that's long-term. Other individuals, they have temporary medical needs. So obviously they might have just had an operation and they need short-term needs for social care. So that's the difference really. So long-term, think they've got something for the rest of their life. They'll have to have care, they'll have to have prescription, they'll need someone to take care of them for the rest of their life. Short-term, think just come out of hospital, had an operation, you might need help with getting dressed, like preparing a meal, or taking and picking up children from nursery or school. So, however, once you're recovered from that, then you might not need to use the short term anymore. So, obviously, that's when the support ends. So, another example of short-term care might be when a child has to go to an emergency foster parent. So the primary carer might have taken ill, they might have gone into hospital, and their child has to go into emergency foster care because they haven't got any other family members. So that's an example of short-term needs. Residential care provision. So obviously there's different types of care that can be covered for residential. Example, older adults who need support with daily living tasks, younger children, or physical disabilities, and residential homes for children who might have physical and emotional and learning difficulties. So residential care home, that's just a care setting where individuals have their own room within a shared building. Obviously, these same care homes provide communal areas like a dining room, sitting room, gardens. They can speak to other residents, and they might be able to eat with each other, and they have a bit of a social life as well. The residential care homes are normally staffed 24 hours a day. They provide meals, personal care, cleaning, laundry, and daily activities. So, nursing homes provide medical care as well as personal care. So the staff include qualified nurses normally. Some residential homes include nursing care to specialise in certain conditions. So, for example, they might be specialised in dementia. Supported living. This is normally where individuals live independently in their home, but they are provided with support. So they might have a learning disability. With a learning disability can live independently in a supported living flat, but receive help with money management, household tasks, making healthy choices, like for cooking meals and dietary reasons. Sheltered accommodation, which is also sometimes known as extra care accommodation. So this is individuals who live in their own self-contained flat, which they might own or they rent. They also have a communal area, a lounge. They might have a restaurant on site, gardens. There is a warden, obviously, that walks round, and there's always someone on duty who can be contacted by residents if they need support. So that's sheltered accommodation, sometimes known as extra care. Right, then, excuse me, sorry. Then, community care provision. So, community care services normally help individuals who require care and support to live with dignity and independence in their community. So it's another way to help them avoid social isolation, because that is quite a big problem amongst older adults especially. So it includes older adults, individuals who have mental illness, learning disabilities or physical disabilities. So normally the main aim for providing community care provision is to enable those individuals to continue living in their own home, remain as independent as possible, but it's run by the local authority who arranges and provides community care services. It's sometimes provided by volunteers or purchased by service users from private businesses. So what does that mean? Well, for community care provision, obviously that can mean home care help, as it says, and home helps. So home care help is bathing, washing, getting up out of bed, getting in bed, getting dressed, going shopping. Home helps is general tasks, so cooking, cleaning, maintaining hygiene in the home. Adaptations in the home, so provision of a stair lift, for example, lowering worktops in the kitchen because the individual's in a wheelchair, or minor adaptations such as like handrails in the bathroom or a ramp at the front door. Meals, daily meal delivery service, that's a good example. So like Meals on Wheels, they call them, or monthly delivery of frozen meals. And then it means you can have 3 meals a day and it comes straight to your house. Types of service, activities, providing transport to attend day centres, lectures, outings and culture activities. So that's another example of community care provision. So jumping on a minibus that takes you to a new chess club, for example, or a new club that helps elderly people meet new people and socialise. Right, respite. So respite is normally time limited and it's temporary. So normally it's provided for caregivers of a child or an adult. It can be planned or unplanned. For example, in the case of an emergency, it normally gives carers the opportunity to have a break from their caring duties. So they're able to spend some time looking after their own needs, safe in the knowledge that their loved one is being properly looked after by professionals. So that's respite. So it's basically having a break to look after your own needs, whilst a professional looks after the person you would normally care for. Rehabilitation, excuse me. Rehabilitation services are a specialist service. They aim to improve an individual's independence during and after an illness or after an accident. So, for example, for someone who's had a stroke, or they might have been injured in a car accident and they've lost the use of an arm or a leg, then, or people whose speech has been impaired, they may need rehabilitation or rehab. So that could include an occupational therapist to help the individual learn techniques so they can learn to wash, get dressed, or prepare a meal again. A physiotherapist to help develop and improve mobility, such as getting from bed to a chair, or exercises to improve balance and coordination. A speech and language therapist to provide help and support to try and improve or regain speech. So a example is someone in my family had a stroke. They couldn't speak. They lost one half of the body, and then they had to have an occupational therapist, and they had a physiotherapist, and they had a speech and language therapist to help them get back on track. So now that person can walk and drive, but it took about 7 months for them to get out of that stage. So rehabilitation, that's the type of care provision. So specific service provision to meet needs. So this one, quite interesting, because for this we think maternity services, mental health services, alcohol and drug addiction clinics, or hospice care. So maternity services, they are there to meet specific needs. So antenatal care, including midwife checkups, classes, information sessions to attend before the baby is born. So for example, how to be healthy during pregnancy and what to expect during labour, how to feed and look after the baby, that's a maternity service. Postnatal care, health visitor service is provided after the baby is born, and that also includes checks carried out on the health and well-being of you and the baby, or the mother and the baby, I should say. So special care baby unit, which provides intensive care for premature babies. So if a baby's been born a lot earlier than expected, they'll go into the special care baby unit. The Well Baby Clinic carries out regular checks on baby's growth and development progress. So obviously they can say, right, well, they're not moving at this rate, or they should be able to speak at this rate, and they can advise you on that. Another is mental health services. So counselling, other services for individuals who might have specific emotional needs. So they might have had a traumatic experience, or they might have been in quite a bad car crash and now that they can't go in cars, whether they're the driver or the passenger. So that's a little example. Specialised help for those with an eating disorder. So that's under mental health services as well. An individual with Alzheimer's may need constant 24-hour care. So they'll go into a nursing home that specialises in dementia. Alcohol and drug addiction clinics. So these clinics are provided by the NHS, by private clinics where individuals pay for the services themselves, and by charity organisations such as Action. So there's the 3. So you can go to NHS, where there might be a bit of a waiting list, private clinics where you might get in, tomorrow, or there's charity-run organisations which most likely are very little or free, money-wise. Service users attend a programme of intensive support at a local clinic or residential rehabilitation service. So the final one is hospice care. So it's that at the hospice is a form of care that aims to improve the life of people who have an incurable illness, as well as providing support for patients, family and carers. The care is free. It's paid for combination of NHS funding and public donations. A hospice provides pain and symptom control. The hospice provides holistic care by supporting the patient's emotional